Hey everyone, and welcome. Today we're diving into a topic that can, let's be honest, sideline just about anyone: knee ligament injuries. We're going to walk through the entire process, from that first ouch moment all the way through a full recovery.
Have you ever had that feeling? You're playing a sport, maybe just stepping off a curb, and your knee just gives out? Or even worse, you hear that unmistakable pop. That feeling, that sound, it's often the very first signal your body sends that something serious has just happened inside your knee.
And that pop, it's not just in your head, it's a real, often audible sound. And it's your body's alarm bell that a ligament may have just torn. That's the moment you know this is more than just a simple bump or bruise. It's really the start of the whole recovery journey.
Okay, so what's actually going on inside that knee of yours? Let's meet the 4 crucial structures that are responsible for keeping it all together and stable. I like to think of them as your knee's personal bodyguards, the essential ropes holding the joint in place so it can do its job.
So check this out. Each of these ligaments has a specific weakness. The ACL, that's your anterior cruciate ligament, it really doesn't like it when you stop on a dime or pivot suddenly. The PCL, the posterior one, that usually gets damaged from a big direct impact, like in a car accident. And then you've got the guys on the sides, the MCL, which gets hit from the outside, and the LCL from the inside. You see? Each one of these guardians has its own kryptonite.
All right, so that pop is the first big alarm bell. But your body doesn't just go silent after that. Oh no, it keeps talking to you. It sends out a whole bunch of other signals telling you, hey, it's time to get this checked out. And ignoring these signals can lead to much bigger problems down the road.
So here's your checklist, the key things to watch for. Swelling that just blows up within a few hours. That feeling of your knee being wobbly, like it's going to buckle underneath you. Or maybe you just can't bend or straighten it all the way. If you're nodding along to any of these, that's your cue. It's time to call in a professional. So, you've listened to your body, you've gotten it looked at. What's next? This is where we turn a corner, folks. We're shifting from the problem to the solution. And the road to recovery? It's a clear path, and it's probably a lot more manageable than you might think. Treatment isn't a one-shot deal. It's a journey with a few key stops. First up, diagnostic imaging, like an MRI, to get a really clear picture of the damage. From there, the road can kind of fork. You might go the non-surgical route, or surgery might be on the table. But here's the most important part. No matter which path you take, they both end at the exact same destination: dedicated rehabilitation.
And it's super important to understand that not every ligament tear means you're going under the knife. Not at all. As you can see, there are 2 main playbooks here. For milder sprains, we're talking about things like rest, a brace, and a lot of physical therapy. Surgery, which is usually a minimally invasive procedure these days, that's typically for the complete tears where the knee is just too unstable to function.
And now for the part everybody really wants to know about. What happens after the treatment? Can you actually get back to 100%? This is the most hopeful part of the journey, where we look at what a full recovery really looks like.
All right, let's talk timelines, just to set expectations. 6 to 9 months. That's the number you'll hear a lot, especially for something like an ACL reconstruction. And yeah, it's a marathon, not a sprint. Proper rehabilitation during this time is absolutely everything. It is the key.
This is the million-dollar question, isn't it? After all that, after the injury, the treatment, the months of rehab, will you ever really get back to your old self? It's the #1 concern for pretty much anyone facing this recovery. And the answer, thankfully, is a big, resounding yes for most people. With a successful surgery and, here's the crucial part, dedicated physiotherapy, regaining that full strength and stability isn't just possible, it's the expected outcome. Your commitment to the rehab, that's the secret sauce. It makes all the difference.
But let's flip the script for a second. What if you ignore the signs? What if you just try to tough it out? This is a really critical point for your long-term health.
Here's the bottom line. An unstable knee joint doesn't move the way it's supposed to. All that unnatural wear and tear on the cartilage from abnormal movement significantly increases your risk of getting arthritis early. So getting proper treatment isn't just about getting back to your favorite sport, it's about protecting the health of your joint for years and years to come.
So we'll leave you with this question to think about. Understanding the signs, knowing the process, and seeing that a full recovery is possible, well, that's the first step. The next one, the most important one, is taking action.